association plans?
Let me just read it.
So on my time,
Gentlemen,
I will yield to the chair lady to fill in this gap.
Association health plans provide both maternity and newborn benefits. For large group association health plans, Title VII, the Civil Rights Act requires the plans to cover pregnancy, childbirth, and related conditions in the same manner as they cover other medical conditions under the association health plans.
Would you mind providing us the section in the law that provides that?
Well, we had an amendment.
Gentleman from Texas controls the time.
I thank the chairman. I was trying to provide some flexibility to kind of bring that matter to a conclusion. The question I would ask, though, Chairman Foxx or Chairman Smith is, okay, if that is true, or whether there is a requirement that there is that coverage or not, does that increase the cost for the businesses in question? Would the increased coverage requirements, whatever they may be, likely increase the cost of the health insurance coverage for a business, whether it's a large corporation, you know, those grand corporatists in Orlando at Walt Disney, or anybody else, if they're providing insurance, if they provide greater coverages, whether it's required by law or whether it's by choice, does it cost more?
Generally, I would say yes.
Right. So therein lies the whole question that we're talking about. And thus it has always been, is who pays? That has always been the fundamental question, is who pays? And then what are we doing to overall prices, the overall price of care and the quality of care when we make choices about how that care is administered? That's it. That's the whole thing. And we go around like championing one thing or the other in some big, speech for politics about we will cover maternity care, we will cover this, we will cover that, and pre-existing conditions. And all you're doing is blowing the lid off of costs. That's what you're doing. By definition, as has borne out, that's what you're doing. And in the process, by the way, enriching large corporations massively. And of course, their investors, whomever they may be. There are a couple of data points out there. I wonder if either of the two chairmen or the ranking member would like to comment. According to the Bureau of Labor and Statistics, medical and health service managers, which are described as managers that, quote, plan, direct, and coordinate the business activities of healthcare providers, otherwise known as bureaucrats, are slated to see a 32% growth in jobs from 2019 to 2029. This is compared to a 4% growth for physicians and surgeons. Health insurance companies take in about $1 trillion per year. Health insurance companies. Health and medical insurance companies place second in biggest industries by revenue in the United States, only behind retirement and pension plans, by the way. The deals they strike with the government, most notably and most recently, the massive deal struck under Obamacare, guarantees that success and growth rate. For example, Anthem had a 344% increase in government revenue from 2010 to 2020. United Healthcare had a 198% increase in government revenue. Cigna, Anthem, United Healthcare, and Humana have seen an average increase of 562% in their stock price from January 11 to January 21. Additionally, in 2016, 60% of the nation's top 5 health insurers' revenue, $213 billion, came from Medicare and Medicaid, up from $92 billion in 2010. In 2018, for at least 3 of these companies, the majority of their revenue, I want to state that again, the majority of their revenue comes from the government. United Health, 53%, Anthem, 58%, and Humana, a whopping 86.9% of the revenue comes from the government. Small businesses cannot break into the big insurance market because they are small. And my Democrat colleagues want them to be left with no options whatsoever. So we slide closer for Medicare for all. That is precisely what my Democratic colleagues want. Precisely what they actually campaign upon. And in my experience, when somebody tells you something, you should believe them. That's the truth. The exceptions that Republicans are putting forward at the moment, modest. With all due respect to my colleagues, these are crumbs. These are crumbs from the table. Important ones, I support them, but it's like taking Dixie cups of water and throwing it onto a massive fire and pretending that you're leaving something behind that's going to save the house. But you're not. Because all we're doing is continuing to fuel the corporate crony insurance-run healthcare that's not really care. It's corporate crony insurance-run health management that is destroying the ability of individual doctors to provide care, the ability of individual people to get care, and driving up the costs. And here we have the complaint that this would cost, according to scoring, in this world in which we operate in D.C., where scoring is how we decide policy. And the complaint is it would cost $300 million. I don't know if that's a 10-year budget window or 5-year. I don't know. Somebody could fill me in on what it is on the window for the $300 million net. And I remember I heard the Chairman Smith, say, well, we could pay for that. Well, of course we could pay for that. We literally have $22 billion just sitting over the Department of Commerce after the debt deal, just sitting there, ready to be used for whatever you want to go spend some of this magic money on. So you can pay for this if you want to. The question isn't that. The question isn't whether or not you're going to say, wait a second, we're going to pull people out or allow them the option to get out of this and say, I want to go provide this other solution, this business. I want to go provide this other solution. So healthy people, allegedly, could be a large number of people, but want to go into that solution, and that allegedly pulls certain people out of the pool and drives the cost up. Well, that kind of gives up the game, doesn't it? I mean, that's the whole point. My friend from Virginia is talking about, well, we're averaging the cost. Those are the terms we use in the swamp, right? We're averaging the cost. Well, what does that really mean? That really means we're saying you American, you have to pay X for whatever we allow you to have, we the government, through our wisdom, this is what you're allowed to have, and as a result of that, you'll be a part of this pool, whether you like it or not, so that we can, quote, spread those costs out so that we can provide, quote, unquote, coverage. That's what that whole convoluted scheme is. But in fact, when I came to Washington, I was put on Obamacare. I was put on Obamacare because, we don't have those gold-plated plans that everybody always says we have out on the Twitterverse, right? What we have is Obamacare, which is far from gold-plated health care, let me assure you. Because coverage isn't actually care. The fact is, at least the last time I checked, these things can change. The last time I checked, if I were on the Obamacare plan that I would have through my job as a member of the United States Congress, I wouldn't be able to go to MD Anderson, which was the cancer center in Texas that I went to in order to combat cancer in 2011. Now, in what universe is that care? It's not. We go around patting ourselves on the back because we throw people into coverages and we expand Medicaid massively to the tune of the 22 million people that we allegedly expanded coverage to. 11 million of those were put on Medicaid. Hardly something people run around saying, well, that's a better solution because you ignore the 6 million that got taken off of their private insurance plans after Obamacare was put into place. Now, we can go around this barn 100 times, and everybody goes around talking about, pre-existing conditions, and, they like to thump their chest about what all is, the greatness of Obamacare. But the fact is we have a massively broken system that is enriching a small cadre of folks and corporations to run insurance-run health management rather than care. I would throw to both of the chairs of the two committees here, do you agree with that sentiment? And it is not the whole point of these bills to provide greater options, to provide more affordable options for small businesses, to be able to allow more Americans to be able to access options in the healthcare system rather than being pigeonholed into very tight, fewer options from a government-run system or government-controlled options?
It absolutely, Mr. Roy, provides more options. On point that you hit on earlier, the expanded Obamacare subsidies that was passed by Democrats just recently, that money flowed directly to those large health insurers, what you were talking about.
Right.
What's different is the choice arrangements that we have here allow small businesses to reimburse their employees directly. So those employees can go purchase what option of health insurance we want. So we're doing the complete opposite. We're not allowing those big health insurers to have all the money directly from government. We're giving it to the individual so they can pick the plan that best fits their healthcare needs.
Ms. Fox?
Yeah, and I think to summarize what Mr. Smith just said and what you were saying is it all boils down again to whether the government's going to be in control or you're going to have the individual in control. And that the Democrats always go to government control. Let me give you a couple of additional facts. Employer-sponsored plans have lower average deductibles, $1,763 for an individual ESI plan compared to $5,155 for an individual ACA plan. In addition, they have lower average out-of-pocket cost, $4,355 average maximum for an individual ESI plan compared with $8,519 average maximum for an individual marketplace. So what you're saying, Mr. Roy, everybody's paying for these government plans and what the chairman was saying about the average cost. You're right. It's cost sharing, okay, but for all of us who are not on those plans, we're helping to pay. It shows employer-sponsored plans are a much better bargain than the ACA in every way that you cut it, every way that you cover it. And by creating more choices, you're going to lower those costs even further because you're going to be able to open this up to the farmers Mr. Massey's talking about, the small business owners. So you're going to get people off of Obamacare, hopefully, onto these, and it would be a lot better for them. Well, and the comments you made about all this money going into the large insurers, it's just an abomination. It's just an abomination.
Well, thank you, Chairwoman Fox, and I will be mindful of time. And a couple points. A 2019 study found that only 31% of Americans were able to correctly answer this question. Suppose that under your health insurance policy, hospital expenses are subject to a $1,000 deductible and a $250 per day copay. You get sick and are hospitalized for 4 days, and the bill comes to $6,000. How much of that hospital bill will you have to pay yourself? Most people don't know, and they don't understand the complexities of the system that we've structured. Now, that is an indictment of the entire system. It's not an indictment of Obamacare. It's not an indictment of any of the alphabet soups per se, right? It is an indictment of a complex system that we've allowed to get more complex. The point I will simply make, I offered 3 amendments. One is a resolution that I believe will be made in order. I think there are 2 others that are still being debated about whether they'll be made in order because of the same question that is we're debating about the underlying bill about cost, right? And whether there'll be a waiver or whether or not there's an amendment that I might be making in order because we're able to pay for it. But I had 2 amendments. One would allow healthcare sharing ministries to be reimbursed through an HRA. Healthcare sharing ministries are being used by hundreds of thousands, millions perhaps of Americans as a way to be able to provide affordable care that gives them options to be able to access the doctor and the care of their choosing. And we ought to be making it easier for them, not harder. And that is one of the points that we're trying to address here. So I'd offer an amendment that would have been able to do that. The second amendment would allow direct medical care to be reimbursed through an HRA, the ability to go directly to a direct primary care provider. There are thousands of those that have sprung up around the country as alternatives to the insurance and hospital-run health, quote, care. It's not really health care, let's be clear, that we currently have that's breaking the back of everybody. In July of 2022, last year, Amazon purchased the direct primary care company, One Medical, for almost $4 billion. Now, that is in part because that alternative was providing an option for people. But it is an option that is severely constrained by the massive limitations put on it by Obamacare and the ACA, and that we're trying to free up. Now, the 2 amendments that I've offered probably would score. Yes, because of the same reason we're talking about at the underlying bill would score. But the very score basically gives up the game. It explains why this whole system is convoluted. So I would suggest that these amendments should be made in order, that if these things cost, be happy to go figure out how to find a way to make them pass budget muster and the points of order. Because like right now, we have trillions, hundreds of billions of dollars, probably trillions actually, that are floating out there on the back of massive policies that my colleagues on the other side of the aisle put forward, whether it was the transportation bill, whether it was an IIJA, whether it was the Inflation Reduction Act, which Goldman Sachs says it costs $1.2 trillion, or even, as I said, the modest $22 billion sitting in an account at the Department of Commerce now that is basically funny money for Washington to go play with. Well, why don't we go play with that funny money to free this up for the American people to be able to use it for health care? I yield back.
Gentleman from South Carolina is recognized.